Another option may be surgery. If you are having lumbar decompression with spinal fusion for spinal stenosis, here's what you should expect. This consists of placement of screws and metal rods along with insertion of bone that will serve to stabilize the spine. During the surgery, intravenous lines, a breathing tube, endotracheal tube, and occasionally a catheter in the urinary bladder will be placed. You will be placed face down on the operating table, and your lower back will be washed with an antiseptic soap. The surgeon, nurse, and anesthesiologist will perform a timeout, similar to a pilot before taking off, to confirm that the proper operation, appropriate side, and correct level of the spine is being operated on. The surgeon will make a low back incision in the midline, and the muscles will be pulled to the side and the disc is identified. Lumbar spinal stenosis, or narrowing, is caused by overgrowth of joints of the spine. Nerves that are compressed by these bones will be decompressed by removal of the bone. During the same operation, a spine fusion is performed by insertion of metal instrumentation, screws and rods, and bone that serves to weld the bones together and restrict or prevent motion occurring between adjacent spine segments. A drain is placed connected to an external drainage bag in order to remove excessive blood from the surgical site. This will be removed within 24 to 48 hours. The incision is closed with sutures, and you will be moved from the operating room to the recovery room, where you will recover from anesthesia for 2 to 3 hours. What are your expectations following surgery? You will be given appropriate medication for pain and muscle spasms. You will be required to walk on the day of your surgery. In most cases, you will be discharged from the hospital within 2 to 4 days following surgery. You can return to desk work within 3 to 6 weeks post-operatively. However, if you perform heavy labor, you may not return to work for 2 to 3 months. Occasionally, following a lumbar decompression and fusion, you may not be able to return to heavy, strenuous physical labor. Now let's talk about the risks of the lumbar spine decompression and fusion, including but not limited to the following. Infection. You will be given antibiotics during the operation and for 24 hours after the operation to help prevent infection. Weakness and/or numbness. Anesthetic risks, including the infrequent occurrence of a heart attack, pneumonia, stroke, or death. Failure of fusion to heal. You must quit smoking for at least 3 weeks before operation. Patches or nicotine gum cannot be used.